Hello, I'm Angela, and I'm going to be doing the cardiovascular and peripheral vascular exam for my mother here. So first of all, we're going to be inspecting. We're going to be looking at thorax for symmetry, any possible deformities, lesions, color, any vascular patterns that I notice, and then as well as hair patterns. So her thorax looks symmetrical in shape. No deformities or lesions noted. Color is pink, and then vascular patterns, nothing abnormal, and hair patterns are normal for her gender. I'm also going to be looking at the precordium. I'm going to be looking for lifts, heaves, or possible pulsations. And so I'm just going to pull your shirt down a little bit. So nothing abnormal noted, no heaves, no pulsations, abnormal pulsations. And then I'm going to be looking for her apical impulse. So idealistically, I would have a pen light with me to identify, but basically I would have her just tilt your head back a little bit, and I'll have you look to your left just a little bit more. So right here you could see the external jugular vein. Internal jugular vein is here, but we won't really see it. We'll be looking for the impulse or the pulsation of it. So idealistically with the pen light, I would be able to see the pulsation, which should be like right here. But yes, thank you. Next, I'm going to be palpating. So I'm going to be palpating for the point of maximum impulse. So this can be found on the fifth intercostal space left of the midclavicular line, and the normal size should be about 1 to 2 centimeters. So I'm going to so the fifth intercostal space to the left of the midclavicular line. So it should be right here, and we should be able to palpate the pulse there. Next, I'm going to be assessing for any thrills with the ulnar side of my hand. I'm going to press on the surface lightly across the precordium. If noting any vibrations, it may suggest any murmurs or a turbulent flow of the heart. No vibrations noted upon palpation. Next, I'm going to be auscultating the heart sounds. So I will be using the diaphragm for high pitch sounds, and then the bell for low pitch sounds. So first we're going to be finding the angle of Louis. It's going to be at the suprasternal notch right here. And then 3 fingers width, I'm going to go down, and this is the second intercostal space. So left of the, or right of the intercostal space is going to be the apical, then the pulmonic to the left. Going down, it's going to be Erb's point, and then to the fifth, to left of the sternal border, it's going to be the tricuspid, and then to the fifth intercostal space, to the left of the midclavicular line, it's going to be the mitral. So then, when listening to heart sounds, S1 should be loudest at the pulmonic, aortic and pulmonic, and then S2 should be loudest at, S1 should be loudest at the tricuspid and mitral, and then S2 should be loudest at the aortic and pulmonic. I'm going to be auscultating for murmurs, clicks, rubs, and any extra sounds like S3 or S4. So just for exam purposes, I'm just going to be auscultating with the diaphragm. But for higher pitch sounds, or lower pitch sounds, I would be auscultating for the bell, with the bell. Here, aortic. Pulmonic. Erb's point. Tricuspid, and then mitral. Thank you. Heart sounds noted are S1 and S2, no murmurs, no clicks, no rubs. Next, I'm going to be doing pulse assessment. I'm going to be assessing the radial pulse. I'm going to compare bilaterally. So the radial pulses are right here. So I'm going to be assessing bilaterally. Okay. And they're +2 bilaterally. Next, I'm going to be assessing for capillary refill, which they should be less than 2 seconds. So I'm going to be pressing on the fingernail, a couple seconds and letting go, and capillary refill is less than 2 seconds. Next, I'm going to be assessing carotid arteries. I'm first going to auscultate for bruit with the bell of my stethoscope. Then I will then palpate only if no bruits are noted. So no bruits noted, so I then am going to palpate the carotids, but we're not going to palpate both at the same time. We're just going to go one at a time. And they're both equal bilaterally +2. Next, I'm going to be looking at the neck vessel. So I'm going to be assessing for any jugular vein distension, which upon inspection, I don't note on any either side. And then for the peripheral vascular exam, overall I'm going to be looking at her skin color, temperature, hair distribution, symmetry, any varicosities, and then lesions, which upon general inspection I don't notice any abnormalities. Skin color is normal, temperature is warm, hair distribution is normal for patient, and everything is symmetrical. No varicosities or lesions. And then on palpation, I'm going to assess the skin temperature, which is generally warm and normal. Skin trigger, which it snaps back right away. And then edema. Upon inspection, I don't notice any edema, but if I were to palpate, no edema noted whatsoever on all extremities. And then pulses would be the dorsalis pedis, which is on the foot, posterior tibial, which is on the lower leg area, and the femoral is close to the groin. And femoral only if needed, but every pulse is +2 normal. And then lastly, any special tests. So the Allen's test would basically be with her arm here. So I would have her make a fist, pinch in between the wrist, and then I'll have you squeeze again, and open your hand, let go, and then blood should return to her hand quickly. And then the venous filling time, ideally the patient would lie supine. We would elevate one leg for about 60 seconds until all blood flow goes into the rest of the body. And then we would have the patient immediately sit up with letting the leg hang down in the dependent position. Ideally, and for normal results, it would fill up within between 15 to 20 seconds. And that is the end of the cardiovascular and peripheral vascular exam. Thank you.